Hello and welcome back to another episode of Together We Can. I'm your host Kevin Bargender, and today I'm joined by community health worker Penny Paulson of the ADRC in Trempealeau County. Welcome, Penny.
Good morning.
So do you want to kind of tell us what your job entails?
Sure. Well, my office is at the ADRC here in Trempealeau County, and the majority of my work is out in the community with individuals either in their homes or participating in senior dining or even home delivered meals, sometimes hospitals and assisted livings. So my role is to meet people where they are, to help them to be successful with their goals, and to reach an underserved population and to sort of help fill the gaps. The ADRC has a wealth of information. They are about all things seniors and adults with disabilities. They have a boatload of information and resources to offer. My position as a community health worker complements that, as I'm able to be sort of more of the hands and the coach out in the field to help folks sometimes navigate that information or the resources that they need.
So I know you want to talk about medication today. That was kind of a big topic. Do you want to explain the role of the doctor and the patient when they're reviewing medication?
Sure. First, I might just let everyone know I am not a doctor and I don't give medical advice. So the idea of a community health worker offering assistance with medication review might seem sort of foreign, but let me give you a little background. In the United States, one person dies every day from medication mistakes that could be prevented. We know that about 1.3 million people are injured in the United States every year as a result of a medication mistake that could have been prevented. So what we find is, of course, the doctors are doing their jobs. They're using their expertise to evaluate and treat patients, and pharmacists are offering information about side effects, and all of that information is excellent. But then we as consumers need to go home and put all of that information together in a way that makes sense for us and then manage successfully. And what we find is that for many of the people that we work with, for more than 50%, simple medication errors at home are occurring, and we can help with that. Is especially evident when folks are discharged home from the hospital and there have been changes. So you know that when you go to the clinic, the providers there will ask you what your medications are and if you've had any medication changes, right?
Mm-hmm. Yes.
And I think that's the standard everywhere. And providers in the clinic are responsible to reconcile those medications so that the doctor is aware of what you're doing, so that they have that information in mind as they make recommendations for next steps. Are you aware that the doctors are interested in knowing what vitamins you might be taking, what probiotics you might be taking, what supplements you might be taking, and the importance of that?
Yeah, absolutely. I know even personally when I go to the doctor, they always ask, any additional prescriptions or non-prescriptions that you're taking. So are you qualified to assist with that?
Yes. Yeah. Again, not to treat or to give recommendations, but to go into someone's home and to help understand exactly what they are doing. So I worked with a gentleman who was seeing the doctor and was sort of struggling at home in a few different ways. Just wasn't really responding well to treatment. Didn't have effective pain management, and we really couldn't figure out why. And so we went into the home, and what we found in that case was that this gentleman was taking 2 of his 7 prescription medications only because he was very, very worried that he would not be able to afford his medications. And in his mind, it made sense to make all of those medicines last for as long as possible to save money. And with some education and the help of a medication planner, he was able to recognize the benefit of following through with his medications the way that the doctor had prescribed them. And we had worked through some information to be able to help him to save some money too. I constantly say to people, you are worth it. So if it costs a little more, you are worth it. Or if this is really the way that you want to take your medications at home, if you only want to take 2 of the 7 that are prescribed, it is very, very important that your doctor know that. And that way they can use that information to be able to make treatment decisions with you and for you. I remember years ago sort of hearing a joke about someone with Parkinson's was asked, why are you taking 7 different medications for Parkinson's? And the gentleman responded, well, the first 6 didn't work. And there's kind of a ba-dum-bum after that. And ultimately, what I'm trying to get at is that we as consumers, the clients, our seniors, disabled folks, and everyone in their home really needs to be in charge of their own health care and to give it everything that they've got and to be their own champion, to make very sure that the information they're taking to their clinic visits is accurate. It matters, and it really does help the doctors to make a meaningful difference in treating. Whether it's missed medications because of a worry about finances, or if it's because maybe I don't remember very well anymore, and so I'm not remembering to follow through with my medications. Or maybe I don't remember if I just took them or I was just going to. It's sort of a recipe for disaster, and there are some really simple things that can be done to help work through some of those challenges. When my life is calm and everything is going well, and I stay on a routine, I have no difficulty following through with my medications every morning, with the supplements I take. It's like clockwork. Drink the coffee, take the medications, go to the bathroom, take a shower, get ready for work. Throw in an illness or a change in routine, or even make it a Saturday morning that's especially hectic with grandkids visiting, I may not be as good at remembering and following through with those medications. And if we make a mistake one time, I think we're just human, right? But some of the mistakes that are made with medications can be really serious, can lead to hospitalization and even death. So learning about what folks are really doing at home and helping them to be able to communicate that effectively with their healthcare provider is key to success, to help reduce risk of errors and keep people safe at home. The number one reason that folks, one of the main reasons I should say that folks decide in their minds or families decide that nursing home is needed is because of a struggle with taking medications appropriately or being able to have enough services at home in order to ensure that medications are followed through appropriately. So that's really a pretty big deal.
Yeah, your medication really is your lifeline. You know, sometimes if some medications, if you stop taking them, it can take maybe a month until you really notice, but then some, if you miss a day, it could really make a huge impact. What are some of the ways that people can help remember how to, to take their medication on a daily basis?
Sure. There are a lot of simple strategies that can be done at home. One of the things that we always recommend is making sure that you have an accurate, up-to-date medication list. So after each doctor's visit, you're getting that new updated list and taking it home and comparing it to the bottles that you have to make sure that that you're taking them the way that the doctor has prescribed. Or if they don't match up, that you're taking action and calling the doctor or the nurse for recommendations about what should be done. The medication planners that I sort of showed you, this is just a planner for every day of the week. So if someone is taking medications one day a week, they could be set up in advance in these planners. The individual person can set them up, or maybe a caregiver sets them up for you. So if you know the day of the week and you're able to keep track in that way, you would go to the planner and you would see, okay, it's Friday morning and I'm going to take my Friday pills today. So that's a pretty basic medication planner, and I know a lot of people who use them to help themselves stay on track, even with something that sounds basic like supplements and vitamins. But if they're important to you, that's a very good tool. Another way, when medications are more complicated, is to use medication timers or reminders, or even a medication pill planner that has options for 4 different medications per day, and then labeling them clearly so that they don't get mixed up. Today, with the technology that we have today, there are a lot of different resources available as well that can make things pretty easy, or at least easier. So many folks have Alexa, or what's its partner?
I have a Google Home,
Home
at my place, but
sure.
Yeah, and that kind of works pretty similar to Alexa as well.
Sure. So maybe you ask your smart speaker, Alexa, remind me to go to the pharmacy tomorrow. Alexa, set an alarm for 7 o'clock. Hey Google, set an alarm for 5 o'clock so that I remember to take my medications. And those reminders can be set up with as much detail as is helpful. They can be set up for many, many times a day. Family members can help with that. There are also devices that are meant specifically for that purpose. So medication reminder systems that offer the ability for a family member to put a message in there that says, "Good morning, Mom. It's 7 o'clock. Go ahead and take your medications and please drink a full glass of water." And that sounds pretty detailed, but really what a simple thing to help someone to be successful. And those can be set up on timers. This is another simple tool to use for medications. So maybe your loved one is still going out to work every day, but just can't remember to take those medications. And they're important. Maybe it's a heart pill or a medication for diabetes, or medication for depression or anxiety. So this is it looks much like a pocket watch, and you put it in your pocket. You set the timer for whatever is appropriate for you, and that timer goes off. You easily open it up, take your medications, and move on with your day. There are also some really useful tools at many of the pharmacies. Our local pharmacies in Blair, Whitehall, Gillsville, Osseo, all are willing to help with strip packing medications or bubble packing medications. And what a great tool there, because who's setting that up? The professional. How are they setting it up? Based on the way that the doctor recommended them. And our job then is to learn how to use those tools and follow through. Do you ever, when you go to the doctor, do you always like everything the doctor tells you?
No, not every time, but sometimes, yes.
Do you 100% do what they ask you to do?
I try to.
Do you?
I try to.
Well, you are a good man. Most of us don't, and it may not even be on purpose. We've been used to doing things a certain way for a long time and maybe spend 20 minutes in the doctor's office, and that's just not enough time maybe to appreciate the value of what the doctor's recommending, or maybe it takes practice and sort of proof to be able to learn and understand that that's a good thing for you. A medication error doesn't really sound looming and dangerous, but again, medication errors can be very serious, even deadly.
Yeah, I know that you wanted to also talk about how they can lead to falls as well, which is very serious. Do you want to kind of get into that a little bit?
Sure. So every medication that we take has an intended purpose, and they all also have potentially side effects that can affect us. Some medication instructions may say to drink with a full glass of water, or to take on an empty stomach or on a full stomach. And some of those medications may say has a risk for falls. There are certain medications especially that can increase the risk for falls, and that's a discussion certainly for your doctor or the pharmacist. Falls are another pretty significant reason that folks feel that they are no longer able to stay in their homes, and many of those falls are preventable too. So there again, there are risks to everything that we do and side effects, and in working with your doctor, your primary care provider will help you to weigh out what's most important to you by looking at those risks and benefits. And they can do their best job with that, with good information from you. So primary care is key to managing medications at home, and you as individuals are key to taking charge of that and taking responsibility for your own care and health. And that partnership between yourself, your family or caregiver, and the primary care provider can make a world of difference in helping people to be safe and helping to prevent falls. And there are a wealth of other things that can be done to help with falls too. When alcohol or other drugs are mixed with prescription drugs, that can cause an increase in a risk for fall. And that's something that probably most of us know. Sometimes the supplements or the vitamins that we take, or even the medications that we take, can interact with each other and increase the risk for falls. And those are things that you can work through with the doctor as well, if they know specifically what you're doing. So some people will think when they go to the clinic that, I take 4 ibuprofen 4 times a day for my knee pain, but what am I going to do? It's arthritis, and I'm making it, so I probably shouldn't
complain.
I probably shouldn't complain, and the doctor probably doesn't care about that. Or I know I shouldn't, so I don't tell the doctor. And the short and the quick of it is that when your doctor knows what you're doing, their role isn't to tell you, don't do that. Their role is to give you guidance to help you to be successful, safe, and healthy, you get the bigger job of making decisions and taking action with that.
Did you have any suggestions on how to kind of get the most out of those primary care visits?
Yeah, absolutely. Absolutely. So I have moved 19 times in my life.
Wow.
And it sounds unrelated, right? The most hateful job in the world is packing up and moving again, especially as you get older and have collected things. And when you move, there are a lot of things to take care of. Change of address, your license, information with the Social Security Administration. There's a lot to do. And that can be overwhelming. And I feel like medical care is so much more overwhelming even than that. But it's similar because there are so very many things to take care of, and it can be really hard to do alone. Something that is useful in helping, something that can help with that is a personal health record that you put together yourself. So the doctor has one record, that's your medical record, and that's sort of the gold standard. That's what's going on and helps one doctor to know what another is doing in your care. This personal health record reflects what you are doing at home and what you know about your medical care. So I mentioned that it's good to have a medication list. That is a phenomenal idea, and you can take that medication list and after a doctor's appointment go through it. Make sure that you understand what your medications are, when you need to take them, what they're for, if there are any side effects, and then maybe what some red flags are that you should be talking to your doctor about. The personal health record then is a way to sort of document that, not to make a long history of it, but maybe on a Friday night I realized that, you know, when I took that medicine I kind of got a bellyache. I wonder if I could talk to the doctor about that. This is a good place to write down that information and to make sure then that you talk to the doctor about it. You know, how many of us have a million questions in our mind and go to the doctor and, I don't know, they fell out of our heads or something. We don't remember to ask them. And they could be really important or valuable to the doctor in caring for us. So being really prepared when you go to a visit with all of your information, you know, all of your medications, any supplements, vitamins, maybe even essential oils that help you, helps the doctor and the nurses to provide you the very best care. And being able to share specifically how you're taking those medications or to ask questions about that can make a huge difference too. I worked with a gentleman not too long ago who was really struggling to remember to take his evening medications. He was spot on taking his morning medications, no problem at all, but was really not doing very well remembering to take those evening medications. Even with a medication planner, even with some reminders, that just was not what he was used to, but was trying to do that because those were the orders when he was discharged from the hospital. And so when this gentleman followed up with primary care, he was prepared to ask the doctor about that, to be honest about his difficulty with remembering that nighttime dose, and to ask the doctor, is there something else we could do? Would it be possible for me to take medications once a day rather than twice? Or do you have some other ideas? And that allowed the doctor to go through the medications and to make recommendations. And since then, That gentleman is taking medications 1 time a day exactly as they're prescribed, and the provider is aware of it, and he is having much greater success with control of his health problems, and he feels better about himself because he's able to be successful.
So what's kind of the main message you want people to take with you today?
You know, the take home is that there are, you know, we're human. There are a lot of reasons that we sometimes don't follow through exactly like the doctor has intended, and that's okay. We're people who have our own lives. The take home message is to be brutally honest about what you're doing, and to ask for help if you need it, so that you can follow through in a way that makes sense to you, and so you can be successful at home. I am happy to help with medication reviews. They're very, very easy. It doesn't involve making any medical recommendations. It involves sitting down like we are here today and together making a list of what you're doing at home and looking at that compared to your medication bottles and the doctor's recommendations, and getting that information ready so that the doctor can help if any adjustments are needed. You're not alone. Ask for help if you need it to keep yourself safe in the community.
So what are some good ways that people can get a hold of you at your department?
Sure. So you can excuse me, call the ADRC at 715-538-2001. Or you can call me directly at 608-219-6866. We can meet over the phone, we can meet in your home, we can even do video visits, or whatever makes the most sense for you, to keep you well at home where you want to be.
Awesome. Well, I'd like to thank Penny Paulson of the ADRC for stopping down today, and our viewers at home for watching another episode of Together We Can. I'm your host, Kevin Bargender, and we'll see you next time.